Right, okay guys, Assalamualaikum. Okay, jumpa lagi. So this is the fifth video kan, video kelima for this channel. So untuk kali ni saya nak share a little bit on saya punya previous slides on ED Survival Guide for Housemen. Ada 28 slide, kita cuba habiskan dalam masa 5 minit, alright? Okay, 5 ke 6 minit lah. Right, so tak payah goreng panjang lah. So, alright, so when we talk about surviving, okay, kita ada banyak surviving tips, okay. Kalau korang tengok ni kan, ni just Google je ni gambar. So, desert survival tips, zombie survival tips, mengarut lah ni. Okay, your exam survival tips, okay. Sama juga kita ada ED survival guide ataupun survival tips. How should you survive? Okay, your emergency posting. Alright, so kenapa pentingnya tips ni? Sebab boleh tengok gambar ni, credit to One Pine Normal Line. So tengok ni, mamat kecil ni. So this is you lah, houseman kan. So the sad thing about houseman is because you are always okay at the paling kecil kan, dalam food chain kan. So this is the consultant, this is me, this is you punya MO, right? This is you, semua marah. Sama juga pada matron, assistant, nurse, semua marah korang. PPK marah korang, relative marah korang, semua orang marah korang. Tak tahu nak marah siapa, marah korang kan. So okay, so kita akan tengok a little bit on what can we learn. Saya skip lah, nak cepat ni. Alright, so just a little bit on emergency posting. Okay, korang pun tahu, it is one of the part of korang punya posting as a houseman. Okay, some hospital dia ada bagi option untuk ED ataupun NS. Cuma di USM dulu lah, this slide is quite sometime juga. Dulu is ED saja. Cuma apparently sekarang saya tahu ada dah NS punya houseman kan. Okay, so tak valid dah lah ni. Okay, and then usually kita reserve untuk second year houseman as early as 4th posting, and then most of them adalah 5th ataupun 6th posting lah. Okay, ni macam saya cakap tadi, why you have to know how to survive, sebab everyone love to blame you guys. So, and also as a houseman dan juga with respect to emergency posting, it's a very challenging posting, mentally, emotionally, physically as well as spiritually. So, take this case sebab dia penting, sebab it's a preparation before you were sent to outside hospital lepas ni as a junior MO. So penting lah ED skills and knowledge is a must for all doctors. Tak kisahlah you guys decide nak jadi psychiatric MO ke, nak jadi KKMO dan sebagainya, you have to know how to resuscitate and stabilize a critically ill patient. So kita akan tengok on 10 basic rules. Okay, first of all, okay, as an emergency doctor, always work as a team. You never going to survive if you work alone. So work as a team maksudnya dengan you punya nurses, you punya doctors, you punya registrar, you punya specialist. If you don't know, you need to ask. Okay, always ask, always consult, always discuss. Okay, never work alone. Nombor 2, ni sama juga macam tadi lah So just more or less the same. When you are not sure, tanya. Saya rasa, saya tak tahulah kalau Koko pernah marah houseman tanya kan, tapi saya rasa in general saya jarang lah marah whenever a houseman ask any question. For me, there is no such thing as a stupid question. Of course, some of the question kita rasa macam very unprepared of you untuk tanya. Sometimes kita rasa macam very basic, yang mana we expect you to know kan. Tapi tak apalah, tanya je lah. Cuma you should have an effort from your side juga to revise and to balik baca dan sebagainya. Alright, so nombor 3 juga, okay, as an emergency houseman or doctor in general, don't be a hero. Okay, jangan rasa whenever you encounter a difficult patient kan, contoh a difficult intubation, you rasa macam alamak susah lah. Okay, always call for help. Jangan jadi hero, because it is not about us, it's about the patient kan. So kalau kita orang kata fuck up kan, kita yang susah, patient yang susah, kesian patient. Alright, so it is better to err on the side of having called too early than to call too late. Tak apalah tersalah refer awal, tersalah panggil help awal rather than too late. Okay, so rule yang keempat juga, always respect your colleagues and always be friend with everyone. Saya selalu pesan, kita dekat hospital ni, we are here to make friends, not to make enemy. So especially those who are working with you kan, your nurses, your MAs, your PPK, of course dengan your MO and your specialist, of course korang respect lah. Tapi bila bercakap pasal nurses, MA, PPK, your junior houseman kan, contoh korang dah masuk awal, you dah finishing your ED posting, ada yang baru masuk, so respect them as well. Dan juga don't forget to respect other departments punya doktor juga. Kita jangan bergaduh lah. Alright, nombor 5 adalah know your case in and out, especially before referral. This is very important sebab most of the referral is done by houseman. So if you guys tak study first before that, you are going to bukan kill yourself lah. You macam gali korang punya kubur sendiri lah. Dan you are going to waste time sebab you are not sure, then you kena refer balik dan sebagainya. Okay, this is just a tip. Okay, kalau korang pernah Google pun ada the mnemonic untuk refer any patient kan. You can read after this lah. So ISBA. So I'm not going to go into detail on that. Alright, number 6. Okay, as a ED houseman juga and an emergency doctor in general, always rule out life-threatening causes first. So for any patient and any presentation yang datang dekat you guys, rule out life-threatening dulu before jumping into even a common diagnosis pun. Kena consider life-threatening first. Nombor 7, okay, if you need to choose, sometimes kita perlu memilih, it is always better to overtreat than to undertreat. Okay, maybe the term always ni tak berapa sesuai lah. There is always exception to everything kan. Tetapi in general majority of the time, majority of the circumstances, it's better to overtreat a little bit, over-investigate a little bit rather than kita undertreat or under-investigate. Alright. Nombor 8, okay, diagnosis is based on your clinical judgment. Imaging and investigation are only there to help and support. And this is very basic. Okay, even korang belajar dekat you punya medical school, most of the diagnosis, 80 to 90% is based on clinical kan. Your history and your physical examination. Okay, your investigation is there to help you to exclude other diagnoses as well as to support your diagnosis. That's all. Okay, so try as much as possible to avoid unnecessary investigation. Kalau tak perlu hantar VBG, tak payah hantar VBG. Kan, jangan ambil everything under the sun because at the end, patient is going to pay. So, kesian patient. Right, so nombor 9 juga, okay, kena tahu that you ada a lot of quick guides, short notes and criteria that you can use at your disposal kan. So ni yang saya pernah bagi tahu in the, if not mistaken, second video on WeCam kan. So this is my favorite note taking punya apps lah, G-Notes. Tapi saya tak galakkan untuk guna sekarang sebab dia macam dah tak berapa supported sangat, ada problem sikit untuk synchronize dan sebagainya. So sekarang saya pakai Google Keep. Google Keep. But whatever note taking apps yang korang ada, go ahead lah. Okay, and this is another very great apps juga, QS Calculate. Saya selalu guna juga. Dan always know your score sebab kita dekat emergency, kita ada banyak score yang kita boleh gunakan. Alvarado and Ripasa untuk appendicitis, you ada Canadian untuk decision for CT brain in adult, you ada Pekan untuk CT brain decision untuk pediatric age, you ada strap score ataupun nama lain dia adalah saya dah lupa dah. Centaur score, if I'm not mistaken, Centaur score untuk decide on whether acute pharyngitis or tonsillitis is viral or bacterial in origin. You ada Wells score untuk PE and DVT and so on, banyak lagi. So know your scores. Alright, so this is just gambar. Alright, okay, and last kali, keep your cool. Okay, macam saya selalu pesan, apa yang kita nak kena buat first of all adalah untuk bertenang kan. An emergency doctor should be the coolest and the calmest. If you kalut, everyone akan kalut sekali, especially if you are the senior one. Alright, okay. I think that's all. Video ni lama sikit, 9 minit 30 saat. Sorry for taking your time. I hope you guys dapat benefit. Okay, that's all. Wallahualam. Assalamualaikum.